Be one of the talks about actual treatment, not necessarily one specific disease process. So I'm going to try to talk about the PRP viscosupplementation and try to put things into context a little bit. So you're hearing a lot of talks today about a lot of different conditions, and I'll talk about the applications of some of these treatments. And you're hearing all about joint issues, sprains, ligament issues, meniscus. You can get cartilage damage. We heard a little bit about osteoarthritis. You can have tendon issues, tendinitis, tendon tears, things like that. So some of these interventions that I'll talk about are going to be, for treatment of a lot of these diseases. So when you have, when we first see a patient, again, we see that wide spectrum of injuries, and a lot of times the start of the treatment is fairly similar. It's fairly, conservative. And when I talk to patients, I usually just break things down into, different tiers of treatments. Tier 1 being the most conservative, and that's really where we start. And this is really the foundation and the most fundamental, important part. So you rest it, ice it, those things, bracing, physical therapy, oral medications, and other modalities. So those are important. And as you've been hearing through the day today, if those things start to fail, we need to move on to something else. So tier 2 is where we start to have some different types of injection therapy, such as the steroid injections. You hear about the cortisone injections. Again, they may have applications in acute processes where there's a lot of inflammation and we're just trying to get the pain a little bit under control. This is also where the viscosupplementation and the PRP, which I'll talk a little bit about, falls into. So it's in that category. And lastly, tier 3 is surgery. And again, as you've been hearing, all of us, surgeons and non-surgeons alike, surgery is kind of last option. So ideally, if we can come in, the less we can do and the patient still improves, we're just as happy. So again, going back to tier 2, we'll dive into the viscosupplementation as well as the PRP. So we'll start with viscosupplementation, and Dr. Diels kind of talked about the knee osteoarthritis in pretty good detail. So in the arthritic condition, you have wearing of the cartilage and resulting in painful joint as well as functional limitations. So what is viscosupplementation? And as he mentioned, people refer to those as the gel injections. You may have heard of Orthovisc, Euflexa, Synvisc. Those are kind of the trade names for that. But essentially what it is hyaluronic acid is a molecule in the fluid of the joints, in the synovial fluid, that really gives it a lot of its properties. So the joint fluid is not just water. It's a little thicker than that, more similar to like an olive oil. And really this hyaluronic acid gives it that thicker property, and that allows for lubrication and more smooth movement of the joints. And when you have a joint here, you got the bone, the cartilage, and the yellow is the fluid in between. So you need that lubrication to allow for normal function. So when you do these injections, it's often done in a series of injections, typically 3 spaced a week apart. And the proposed mechanism is it's trying to restore the healthy properties of the synovial fluid. So they theorize that the arthritic knee, for example, is no longer producing that healthy fluid. So the way that the hyaluronic acid injection does this is it theorized that it promotes a better endogenous synthesis of a more functional hyaluronic acid, basically meaning the molecular weight is larger. So if we look at the molecular structure of hyaluronic acid, it's just a polymer chain that is just repeating over and over again. And the thought is that if you have longer chains, that's more physiologically normal, and that's essentially healthier fluid. And by doing the injections, theoretically, you're getting that healthier fluid. So by having that healthier fluid, you can have better mobility, decreased pain, and increased function. So with everything that we talk about, we're always trying to see, all right, is there some medical literature to support that, yes, this will be effective? And there's a lot of studies that say it is effective, and some studies that say it's not. There's a couple of very large reviews that were done looking at 10,000 patients. And out of this review, 89 trials, 71 of the trials showed that the viscosupplementation moderately reduced pain. A Cochrane review concluded that based on everything that they looked at, that viscosupplementation is an effective treatment for osteoarthritis of the knee with benefits to pain and function. So we further break things down. we see that the maximal benefit is usually at the 5 to 13 week mark. And the other caveat to this is it's really important to select the patients appropriately. This is really for the mild and moderate osteoarthritis. Once you start to get severe, that treatment benefit really starts to decline. So again, patient selection for all of these is important. And whenever you talk to a patient about procedures, it's risk and benefit. The good thing about this is that the risk is astronomically low. It's really only the risk of the injection itself, so bleeding, infection, but that's really low. You don't really have a reaction to the injectate itself. So as far as safety goes, it's not really much of a downside. There's not really many contraindications to it. So as far as your potential treatment algorithm, it's a safe thing to try. If it doesn't work, you're not necessarily worse for the wear. Whereas, you hear about the steroids, like, Dr. Heflin or other people are talking. If you do too much, that can lead to some downside. So it's a good, safe treatment option. And another treatment option is this PRP that you're hearing. And PRP is a part of biologics, regenerative medicine, and that's a field of study that's new and really in its infancy at this point. It's cellular and molecular biology applied to the body, trying to promote healing and restoring function of normal and damaged tissue. This is where our PRP falls in, but again, stem cells and other things that we've heard a little bit about today, that all falls within this field. So it's a growing and emerging field. So a little bit more about PRP. It's platelet-rich plasma. The blood itself has multiple components to it. The plasma, which is just the fluid, and then the cellular component. And that cellular component is broken down to red blood cells, white blood cells, and platelets. And it's really the platelets that we're after. To define PRP is just super concentrated platelets. So when I have PRP in my hand, that's just saying that I have about 10 times the concentration of platelets in this fluid that I'm holding compared to the normal blood. And the reason why we want it is that the platelets contain a lot of growth factors that we're going to try to utilize and promote the healing within the body. So it's really the growth factors that's within the platelets that are super concentrated.
Is this the patient's platelets?
Yes, yep, I'll go into that in just a second. So as far as applications, this is just a list to really show what some of the things that we're trying to figure out is this going to be effective for. This is not a list of proven treatments for PRP, but the applications for this, the basic science behind it, is fairly universal. So there's a lot of new and ongoing studies now for everything that you can see here. So for us, the main application at this point, with some of the stronger evidence, is for the chronic tendinopathies, and that's something that we do more so than other things. So, just like any other chronic condition, you can have an injury to a tendon, cartilage, whatever, and normally the body heals itself. Well, they come and see us when it doesn't heal. So what do we do about it? Well, the body, the reason why you get these tendon problems, kind of long term, is you have, deranged healing. So normally you have an injury and you have this inflammation cascade that brings in growth factors and healing properties to the diseased tissue. So with this inflammation comes all those nutrients and things the body needs, and eventually this leads to the maturation and normal healing of that tissue. What can happen, say you have your Achilles tendon and you have this chronic tendinopathy of the Achilles, you have this deranged healing. So the tendon is a very dense, a lot of dense collagen fibers. And biomechanically, you want them all in parallel with each other. But when you have that inflammation, and if they're not allowed to heal properly, they can, you can see here that they're not parallel with each other. So this abnormal architecture can lead to the chronic pain and as well as a weakened tendon. So how does the PRP work? Well, what we're going to try to do is reinitiate that inflammation cascade. So we do reintroduce an injury to that area. And just like I was talking about, that super concentrated growth factors from the platelets that we saw, we're now placing it into that disease, the diseased part. A lot of the tendons, cartilage, there's not a lot of good blood supply. So by taking the platelets with all those growth factors, it's tricking the body to bring in bring in the cavalry, essentially. So you're bringing in all these extra things to heal the area. So we're just restarting this inflammatory cascade and going from there. So how do we administer it? So this answers the question. So what we do, we just take the patient, we draw out the blood, we spin it in a centrifuge, and what that does is it separates the component of the blood. You have the plasma, you have the platelets, and the red blood cells. So we take the part of the plasma that has the platelets in it, and then we administer it to the diseased part of the body, tendon, joint, whatever. What we do and what I think is most effective is you want to try to use some sort of guidance to make sure that the PRP that you're putting in the right place. So a lot of times we're using ultrasound guidance, and this is just a quick example. So you have the patellar tendon here. You can see the nice parallel fibers, but it's thickened proximally here. So the needle, and this is what I would be seeing as I'm doing the procedure. I can see the needle, I can direct it exactly to the thickened part of the tendon, and then I'll actually be able to visualize the injectate going into that area. So you administer the PRP, it takes a few minutes, and we go from there. And there's a protocol. Again, a part of this is physical therapy, things like that. So this is all a discussion. A lot of these have not been proven. A lot of studies are just coming out. Again, this is a treatment option, and this is really a case-by-case basis. So this is something that we would need to talk with the patient, typically beforehand, whether it's one of the surgeons or us, saying, okay, this is what you have. This might work. Is it worth a try, yes or no? And you go case by case, because yes, it is not covered by insurance, and it's not proven in the literature on every case. But it is an option. Again, it's safe. You're only injecting your own blood, so it's pretty safe to do. And we will end there. Okay.